Iain, thank you for speaking to us today.
You're welcome.
Okay, so can you tell us a little bit about your journey to becoming a trichologist?
Well, I've been a trichologist now for over 20 years, and I started in the hairdressing industry. So I started to be a hairdresser, and I was an apprentice for a very well-known hairdresser. Excellent salon and excellent staff, so very top quality stuff, and each of those stylists had a different way of talking about hair and hair loss problems and science to their clients. And I've sort of realised that it's like, there's no set way that people are talking about hair and hair loss problems. So that made me be more interested in the science and thinking, well, there must be some sort of basics about this, and that led me on to trichology.
Amazing. Just for our listeners who might not have never heard of trichology before, could you summarise exactly what does the trichology profession specialise in?
It's a good question, also, because it lives in a niche. Trichologists are not medically trained, we're clinically trained, so we understand and we can recognise and help with hair and scalp problems and disorders. You're probably best thinking about a trichologist as triage for your hair problem. So if we can deal with it, we will deal with it, but we also know who else can help if we can deal with more severe medical issues. So we can liaise with your doctor regarding the issue, we can liaise with dermatologists, endocrinologists. So we sort of live in the gaps between those specialists to get the help that people need, as well as knowing quite a lot ourselves.
Yeah, amazing. So filling in the gaps that maybe some doctors and professions might not go that particular niche down into hair loss.
So doctors don't particularly know very much about hair loss. They are very good at those acute problems, so if you've got a heart attack, fantastic. If you've got blood pressure problems, wonderful. But hair loss lives in that area where you don't have to be ill to get hair loss. You can just be not well. So you will go to the doctors, you'll get a blood test, and everything looks fine to the doctor. And they'll go, there's no problem. Go away. You're not ill. And that's probably right, you are not ill. But that doesn't mean to say that you are not well. And my job is to pick out the nuances and figure out what those very small levels of issues can be, go back to the doctor and inform him of my results.
Got it. What are the leading causes of hair loss, in your opinion?
For men, it is genetic hair loss. So, 50% of men at the age of 50 will suffer from 50% hair loss. It's quite a nice way of remembering that, and that is purely to do with your own genetics. For females, far more complex. Telogen effluvium, which is general hair shedding, that can be due to nutritional, metabolic or hormonal problems. And that in turn, if there's a hormonal problem, that might cause a hormonal or genetic form of thinning for those females. So you've got two problems which are very, very common, which may roll into one with females quite a lot. And from there is also, of course, the autoimmune body of hair loss, so that is alopecias. And those are then formed into non-scarring and scarring alopecias. So you get the alopecia areatas and the alopecia totalis, but then you also get the more severe versions, which are things like frontal fibrosis and alopecia and lichen planus. So there's lots of different reasons. One of the things that people really get mistaken is hair loss just isn't a thing. So when you go and buy a bottle of hair loss tonic, the problem is, what's your hair loss? What is the problem which is causing it? And what is that product trying to do to your hair? So you need a diagnosis about it more than anything else.
So should I be worried about hair loss?
Again, a very good question. Hair loss is an issue which is 90% emotional and psychological and 10% physical. And the reason why is because you can lose every single hair on your head, and if you don't care about it, then there's no problem. But if you do care about it, then it can become a problem. And then there's a spectrum, because the people that can lose very little hair can be extremely upset about it, and then the people that lose a lot may not be, or vice versa. So when should you be concerned about it is when you're concerned about it. If you go one day, you go, actually that doesn't feel quite right, that's just as big a problem as when you start shedding excessively and turn around and go, oh my goodness me, look at all this hair which has just come out. Both are valid reasons to seek advice.
Sure, very personal thing.
Yeah.
Can hair grow back after thinning?
Yes, hair can grow back. The thinning part of it is you have to be careful of what is the thinning. So going back to hair shedding, what's called telogen effluvium, that can be caused by something really common like a low iron level. You correct the iron level and the hair comes back. Really easy. You can get even more acute versions, acute telogen effluvium. That's from a shock, so that's from a car accident or after childbirth. And those you don't even have to do anything. The body just self-corrects itself. When people have been thinning for a long period of time, then you can get some of the hair back, but usually you don't revert back to what you used to have.
Okay, and that was going to lead to my second question, which was, can I get my hair thick after it starts to thin?
Absolutely, you can use hair fibers and things and get it thick like that. That is a cosmetic product which will make your hair feel thicker. But when it's growing thicker, we know now that hair doesn't unminiaturize. So we know that if there is a hormonal problem or genetic problem, hair tends to sort of get thinner over time. We can't make that hair grow back thicker anymore. But hairs grow in groups. So hairs should grow in 2s, 3s and 4s, and usually what you find is that those thinner hairs are in singulars. So you get one single hair in a follicle like that, and what you can do is get those multiples to grow again. So your hair does get thicker, but not because of your hair growing like that again.
Moving on to low-level laser therapy, what are the disadvantages of low-level laser therapy?
So I always treat low-level light therapy as an adjunct therapy or a second line therapy when I'm talking to people about hair loss. They are really helpful because they are non-invasive and there is no side effects. So those are the things that go for it, and there is a great body of evidence to show that it does something to the hair, and I'm sure that you asked me about that in a second. The disadvantage is, I think that it's been marketed wrong. For 30 years they've got the words mixed up.
Can you expand on that a little bit?
Sure. I think that low-level light therapy is a hair health device rather than a hair loss device. So that it's great for people who go, I just want my hair to grow longer, I want my hair to grow a bit thicker, and I want it to feel healthier. So they start using that rather than all the shampoos that they've been using. Within 6-9 months, they'll have healthier feeling hair. I think that when a balding man buys a laser device, he's going to be very disappointed because it's not going to grow hair back to what he thinks it will do. So it's been sold on that huge, it will grow your hair back. And I think it grows hair better, not hair loss growth back.
Sure, I understand. What do you think about combination therapy then for people that are suffering with hair loss, and do you think low-level laser can play a part in that?
Certainly, and it is a great, like I said, it's probably my favourite adjunct therapy. So when people are on first line therapies, which are usually medical therapies, especially for genetic hair loss, like minoxidil or finasteride, those are your go-to backbone treatments. And when they turn around and go, it's doing something, but I just need the extra bit of boost, then that's when you add in the laser therapy, because number one, there is no contraindications. It's not adding another medication or any types of chemicals into the body. It's safe, it's effective, and it really, really helps when you are using other treatments as a booster. What
are some of the benefits of low-level laser therapy?
The benefits of low-level light therapy is that there is no side effects, that it is non-invasive, it's not painful, so it's a very safe treatment. If you've ever gone on holiday and you felt your nails grow longer over that 2-week period, or your hair grow thicker or longer over that 2-week period, that's the same theory. It's light. That's all you're doing. You're using light therapy. Now, obviously, in a sunny hot country we then tan and our melanin gets involved and it stops that process after a while. But for a short space of time our skin reacts to that UV light, and some of that UV light, it penetrates our skin, stimulates nail beds and hair follicles, and it increases the energy output of those cells. And that is simply what low level light therapy does. So we know that it works and it is very helpful, but it's something which has to be, I suppose, not oversold, and it has to be usually preferentially used with other therapies.
Combination treatment. That's really interesting. Moving on to Hairmax.
Hold on.
Quick coffee break. Based on your expertise and experience, why would you personally recommend Hairmax to a patient who is experiencing hair loss?
I usually tell them to look at the Hairmax range because there is a wide range of products for everybody. Now, I think what people don't know is that this device here would be as successful as this device here if they used it diligently. What people are buying between those things, and there is a price difference, but what people are buying is ease of use. So that's going to take you longer to use, but it's cheaper. That's more expensive, but it's going to be easy to use and it's over a shorter time. So that's the benefit. It fits every pocket. You don't have to spend 700 quid on a helmet, so it's going to be a one size fits all. The other thing is that not everybody should use a helmet, because if you've got a lot of hair, and some people just want more hair or want to keep their hair healthy, those teeth move your hair out of the way, so this shines onto your scalp. And a lot of the other devices don't have the teeth to move your hair.
Sure, which covers a lot of my next question, which was about the specific benefits of Hairmax, their particular products maybe compared to other competitors' products. And probably the most important one of those is what you've just mentioned, which is the hair parting teeth.
Yeah, so balding scalp, that you can imagine laser dyers going into the skin, the scalp, and benefiting. But it's got less to benefit because the hair's already retarded at that point and there's going to be less effective generation of hair. But somebody like myself, which my hair is sort of a bit thinning on the top compared to the back and sides, and I'm getting to the point where I'm going, I think I need to start doing something about this, then putting a helmet on my head is, at this point, probably wouldn't be a good idea because it's going to mush down my hair and I don't know how much of that light is going to get to the scalp. It will get to the scalp, but it'll be refracted. And the problem with refracted light is, and the whole point of a laser diode is that the light is very direct. But as soon as it hits something, that light refracts and diffuses. So you're losing that energy towards the scalp.
And the Hairmax devices, because they can part the hair,
the lasers get directly to the scalp.
What specific features of Hairmax stand out to you as a trichologist, leading you to suggest it to patients?
I like the range of devices. There is something for every pocket. You find that people will spend anything to get their hair back, and I don't want them to spend everything that they've got to get their hair back. I want them to spend the minimum amount. So if I think that they will do well with a laser comb, the smaller devices, then that's the one that I can advise them to do that. If they want to spend a little bit more on the bands, then that's great, but I tell them that the difference that they're going to get from that is exactly the same as long as they use it well. Exactly. All they're buying is ease of use. Mm-hmm. So the comb is going to make you use the device over a longer period than the band.
Sure. How do you address concerns or skepticism from patients about Hairmax? And what convinces you to continue endorsing low-level laser therapy as a treatment?
The concerns, I think, stem from the emotive words that come from laser clinics and a lot of the devices that claim things that they shouldn't be claiming. Low-level light therapy helps, certainly, and it is an easy, applicable, safe But usually I go, right, Mrs. X, this is the problem. This is what we need to sort it out. And then if they need a medication, then it usually is minoxidil to start with, because that is the most tried, tested, and the most effective. If they don't want medication, and many people are medication averse, low-level light therapy is excellent for those people because there is no medication involved. For the people who minoxidil doesn't quite hit it, then again, laser devices are really helpful to add into that. So they're a really good second string to my conversations with people. And I've got paper after paper, which Jimenez and all these people that I've done for Hairmax, that shows that it's helpful. I always temper my conversations with laser devices, again, talking about hair health and the ability of the light to stimulate energy, which then imparts into the cells, which then helps the hair grow better. It's usually not, this will grow more hair back.
Does Hairmax laser therapy actually work?
It depends on what you mean by work. So again, for the person who is looking for growing a lot of hair back, using a Hairmax laser comb alone, that might be a stretch. For the person who's using it with a treatment, it's going to be better with than without that first treatment.
Sure.
And for the person who is the hair's thinning and they don't want to go on to long-term medication because of potential side effects, and the person that just wants to keep their hair where they are or just wants a little bit more length, makes their hair feel healthier, yes, that is a good treatment for them.
Sure. So do you think someone who is experiencing hair loss should include Hairmax laser therapy in their treatment?
I think the first thing that that person needs to do is get a diagnosis. We need to figure out what the problem is, and then the treatment comes after that. I think that trying to treat in a blunderbuss approach by just using something for the sake of using something might not work, and that's a negative for a good product, because all it's doing its job, it's just being misused. So if someone's got something like polycystic ovary syndrome or a low iron level, Hairmax may counter the ability of the hair to thin a little bit, but overall the hair will still thin because laser devices will not raise iron or correct hormonal issues. So all they do is they just go, well, that didn't work, and throw it in the bin. And the whole point is that you correct the underlying issues, and this is part of the therapy.
Can you overuse Hairmax, and does it have any side effects?
There's no known side effects, but I would advise people to use as it's directed. There is something called the Arnold-Schultz curve. It's a little graph that shows that there is a maximum amount of energy that cells can absorb from laser devices, and then it just falls off a cliff. So if you overuse it, there's a potential that for some reason that the cells just refuse to work. So it's always best to use as directed. I don't think it causes hair loss if you overuse it, it's just not going to stimulate.
Is there any difference between using a Hairmax device and going to a laser hair regrowth clinic?
Yes and no. There is no difference in the devices that you use. The laser devices have all been based on the original, which strangely enough Hairmax developed. So it's a 655 wavelength and it's a red light. So these devices that you sit under and pay a lot of money for are the same laser diodes. So they can't differentiate that, because then they lose the FDA clearance claim. And they might turn around and go, well, our devices are more powerful. But that doesn't make any sense, because the little cells in your hair that absorb the energy, it's like a sponge. And whether you drop a sponge into a bathtub or a swimming pool, it absorbs the same amount of water. So it's not about power. But what these clinics are very clever in doing is they go, well, we've got a bundle. We're going to give you minoxidil, which is just by the by. I'm going to sit you in front of this really powerful device, and that's going to do all the work. And really, usually it's the other way around. And you spend thousands and thousands of pounds on these things when ideally you can get the same benefit from using Regain 5% foam that you can get off the internet and a Hairmax device.
How long does it take to see results from Hairmax?
Well, again, this is where me and Hairmax differ, because if you look at any study that they've done, they will say you can see differences in 12 weeks. And I think they mean clinical differences. That means looking under a microscope and counting hairs. For the average person to go, something's happening, 9 months minimum.
Can Hairmax be used by individuals who have undergone hair transplant procedures?
Yeah, absolutely. I know that in the US, it's factored into the hair transplant fee. So they will go away with devices to assist, because theoretically it helps with cellular regeneration and the skin and everything like that. I would always advise the person who is going to undergo the surgery to discuss that with their surgeon, but there is no real reason that they can't use it. I'd probably say don't use it directly after, make sure that the skin's healed or the wounds are healed, but then absolutely.
Can Hairmax be used in conjunction with other hair loss treatments or medications?
Yeah, and that's one of the best things about low-level light devices. They are excellent adjunct therapies. They are very good in combination because there's no complications with them apart from time and ease of use. So you can use it with any of the medications that you're going to do, and it's not really going to complicate the medication effects itself.
Are there any scientific studies that support the efficacy of Hairmax?
There's a lot of studies that support both Hairmax itself and low-level light therapy in total. There's about 60, 70, 80 published papers now. They all show that it does something. The problem is that there is no unified presentation of what wavelength or what power outage and the joules and the wattage and things like that. So everybody's singing their own songs at the moment. What they need to do is they all need to get together and unify the type of wavelengths and the types of time and the types of power that is going to benefit. So that's when you'll probably start seeing a significant difference, because there's too many variables at the moment to figure out which one does what.
What's the difference between the lasers that Hairmax use in their devices compared to the LEDs that many of Hairmax competitors use?
The difference between LEDs and the laser diodes that Hairmax use is power and directness of the light itself. So what an LED does is it shines light in all directions, and that will have some benefit. But the laser diodes shine the lights directly on the scalp in a very narrow band, so the power is not lost, bouncing all over the place. So it will penetrate to the layer that it's designed to, rather than a red light just shining on the light and just hopefully some of it will get down there. So, you know, it's not a case of the LEDs don't do anything, because the reason why they realised that the LEDs did is because they put them on the sham device on one of the tests, and it stimulated hair growth a little bit. Not as much as the laser diodes, but it did something. So they went, oh, we didn't expect that. But it's always beneficial to, you know, if you're going to pay the money, you might as well get a product that you know has got the scientific backing rather than theoretical backing. And that's Hairmax.
What's the difference between the laser that Hairmax use in their devices compared to the LEDs that lots of Hairmax's competitors use? So
this comes from a research paper that they used a sham device. So they made a device up and they put LEDs in it rather than the laser diodes. And they found that the LEDs did something. They stimulated a little bit of growth. They didn't stimulate as much growth as the actual device, but they realized that red light just helps stimulate cells. The problem is that the LEDs are dispersed light. So the amount of power that gets into the follicles and through the skin is significantly less than the laser diodes that have a very narrow beam, is very strongly focused, that get down to where it should be. Because that light has to travel about 5 mil down into your scalp to your hair follicles to impart that power. So with LED, you might get some benefit, but you're not going to get the most benefit.
If you're a trichologist, why aren't you wearing a white lab coat?
There's a very good reason why I don't wear a white lab coat, and that's because trichologists don't need a white lab coat. So white lab coats are, when you think about what they are, they're to protect the rest of your clothes from, with doctors, bodily fluids, or if you're in a lab, chemicals. I'm definitely not going to be sprayed with any bodily fluids, and there is definitely no chemicals that I'll be mixing in front of somebody, so there is absolutely no need for me to wear a white coat, apart from to pretend that I'm more important than what I am.
Message to the trichologists, take off the white lab coat.